Hello, Dental A Team listeners. This is Kira Dent, and I just wanted to say thank you so much for being part of my Dental A Team family. I seriously love doing this podcast. I thought I was going to hate it, and I love it. I love it so much because I get to connect with you. I get to hear how this podcast is helping you and your practice be better. So if you have loved this podcast and you are willing to share, I would greatly appreciate if you'll share with your friends, if you'll leave us a review, if you'll give us 5 stars, anything you can do. Just like you guys grow your practices, we're trying to grow this podcast to positively impact the world of dental. This is how we get to grow our Dental A Team family. Thank you so much for listening. I hope you enjoy the show. Hey everyone, welcome to the Dental A Team podcast. We're your hosts, Kira Dent
and Dr. Mark Costas.
Mark and I had this crazy idea that maybe we could combine a dentist and a team member's perspective because let's face it, dentistry can be a challenging profession with those two perspectives. And Dental A Team podcast was created.
I'm a practicing dentist, a multiple practice owner, a dental performance coach, and the founder of the Dental Success Institute.
I've been a dental assistant, treatment coordinator, scheduler, biller, office manager, current practice owner, and international dental consultant. Mark and I don't just understand you, we are you.
Our goal is to positively impact the world of dentistry by sharing our lessons learned from the road in hundreds of dental offices.
2 perspectives, 1 mission, to help dental professionals reach their full potential. Welcome to the Dental A Team podcast. Hello, Dental A Team listeners. This is Kira, and you guys, I am bringing back one of our fan favorite podcasters with me. She has one of the top downloaded podcasts. If you guys have not listened to it, go check it out. It's the one that she's a rock star, guys. She listened to the Dental A Team podcast, heard about our fluoride verbiage, and truly took her fluoride percentage from 37% to 97%. So she seriously has one of our top downloaded podcasts. So naturally, and she's also awesome. I got to meet her in person. She's super, super cool. She's cool on the podcast, but in real life, she's even cooler than she is on the podcast. So I know it's hard to believe, but welcome back to the show, Kristen. How are you today?
Wow, Kira, I am great. That was, no lie, that intro was amazing. I'm blushing over here, but yeah, thank you so much.
You are so good to talk to you. It's great to talk to you. The last time I tried to get her back, I wanted her back after our last podcast before I even knew how I'd perform. And she was kind enough to, endure listening to me at the Las Vegas airport, and it happened to be Shark Week, so we were hearing the Baby Shark song in the background because they thought it'd be funny to play that over and over and over again, and Kristen and I literally couldn't podcast, so I appreciate her being willing to try again today with a totally calm background behind us today.
Yes. Yeah. Quiet, calm. It's good. We're here. We're focused. We're totally in it. So
we are. So
take 2.
Exactly. Here we are. But no, Kristen, you're amazing. You inspired people. I even got emails off of that podcast. So those of you who listen, it really is cool if some guest on our show inspires you. I was able to send those over to Kristen. So thank you guys for sharing. Thank you for being a part of this. And Kristen, let's dive into hygiene today because it was so fun to meet you in person, to come and see your practice, to see you working, to see the inner workings of the practice. And I get to come back and see you guys again in November. So I'm super excited, but let's dive into hygiene and chat about some new ideas today.
Yeah. So, it was great having you there too. It's different, talking to someone over the phone or seeing you lecture, but then actually working one-on-one. Awesome. But yeah, so what I wanted to talk about today was kind of getting into that first patient exam, that new patient exam, or even recall exams as they change, and how the importance of calibrating with the doctor will completely change your appointments. It will change your treatment acceptance rates, and it's going to make you feel super confident in your position.
Absolutely. And I think that this is a big one that I see with hygienists is not catering or calibrating with your doctors. And Kristen, you've got a tricky job. You have 3 different doctors you work for in one practice, and you work with. And so you really have to calibrate and figure it out. And I found that the hygienists who can calibrate with their doctors really will. I mean, you make your doctor's life so much easier. I think as a hygienist, I'm not one, but I would imagine your life as a hygienist is even easier as well. So I'm excited to hear some tips and tricks on how you calibrate with them and how you get your doctors and you aligned in all these areas.
Yeah. So I'm going to go kind of like way back to the beginning when I first got hired at
Let's do it.
True Dental Care.
Yes.
I mean, and way back, I mean, this is almost 2 years, but it feels like a long time ago. But so I had been already practicing hygiene for about 3 years then. I had been in a few different offices. So I got to understand that, some doctors are very conservative and like they're going to, watch things progress until they really can't progress anymore. Other doctors, like anything incipient, they're filling it. So as a hygienist, there's a big range there. But on the first day, Dr. Dan was like, okay, so I'm just going to let you go for it. You can basically tell the patient what you're seeing. Don't tell them like, if you're on the fence about, is it a crown? Is it a filling? Like, don't even mention it. Don't talk about it. Just tell them, there's something going on there. The doctor will take a look. So after that first day, we went through all of the patients that we saw. We looked at all of their x-rays. We looked at all of their intraoral pictures, and we went through their treatment plans. And literally like tooth by tooth. And he's like, why do you think that I treatment planned a crown here? Why do you think I treatment planned filling, et cetera, extraction versus root canal, things like that. And we did that for, at least a month, not every single patient, every single day, but we would check in, once a day through, a couple of the new patient exams just to really make sure that we were on the same page. And that is so important. No one has ever done that with me before. I used to just kind of guess, I was like, okay, well, I'm just going to use like my best, interpretation of the x-ray here and what I think in my gut. But I would say the biggest fear I had practicing was telling the patient they needed something and then the doctor coming in and say, oh no, it's fine. We'll watch it.
Absolutely.
I'm like, oh my God. I'm like, I just prepared them that they were going to need, a root canal buildup in a crown. They're like, oh, they're not in pain. It's fine. We'll leave it alone.
You're like, and a lot of hygienists, when they hear that and they see that, they start to shy away and they don't want to tee up treatment for their doctor because you don't want to look like an idiot. I don't blame you.
Oh, of course. Yeah. Well, and, you don't want to feel like, you're being pushy or whatever. And then it's like, how is the patient going to trust the practice if people are saying different things?
Absolutely. Makes perfect sense.
So what started to happen was I would just kind of like not really say anything. And I knew that wasn't the clinician I wanted to be. I wanted to be, in there in the forefront. So it's really cool, having that opportunity. I work for some doctors that are like, I don't want you saying anything to the patient about their oral condition unless it's about perio.
Interesting.
I'm like, okay, well, that's not what I'm going for. So it's not the right place, but it's interesting. So, being able to have the confidence to actually know that the doctor is going to come in when you're done and they're going to go through the treatment plan that you created and say, I agree. The patient's going to hear it once from me. They're going to hear it once again from the doctor, and then they're going to hear it from our treatment coordinator. So it's like just a full circle. They're not going to have any questions by the time they leave the office.
Oh, I love this. And let's just do a massive shout out to Dr. Dan and Dr. Mila, because the fact that Dr. Dan took that time to work with you and to coach you, I think says a lot about Dr. Dan. And so doctors, look at this. Dr. Dan spent 1 month of his life, 1 month in the last 2 years, calibrating with his hygienist, explaining why he's diagnosing what he's diagnosing. Because doctors, if you want a little secret, we don't know what every one of you thinks, and every one of you does things differently. So like newsflash, none of you are the same. So if you just assume that we know why you're doing things, we have no idea because everyone's different. We don't know what your style is. So Dr. Dan took 1 month with you, Kristen, and that boosted your confidence. It helped you be very, very confident in knowing what he was going to say, which then in turn is going to make his life so easy because now you can tee him up because you've looked at x-rays with him for a month. He's explained to you why he's diagnosing this thing, and then you're able to tee up them for him. And I know the doctors who say, I don't want the hygienist to talk about anything. My hunch is you got burned in the past where like the hygienists were constantly teeing up treatment that wasn't necessary. So you got nervous. And instead of coaching them, you just said like, forget it. Don't say anything. I'll take care of this. But if you can use your hygienist, like Kristen, people trust hygienists. Doctors, I'm not trying to diss you in any way, shape, or form, but they honestly trust their hygienist way more than they trust you in a lot of areas. So they're going to ask their hygienist, hey, is what Dr. Dan's saying really something I need? So if she's already prepping them for what Dr. Dan's going to say, it's really easy for Dr. Dan, and your case acceptance will go up exponentially.
Exactly. Yep.
So,
Yeah.
how were those meetings? Would you guys meet at the end of the day, or how did he do that with you to calibrate you?
It would be different. I guess day by day, depending on how busy we were. Sometimes we would do it immediately as soon as the patient was done, if, somebody wasn't ready to come in. Granted, 2 years ago, we were a little slower. We had just opened, so
Sure.
Luckily we had that time. But even, now, like, sometimes he'll kind of throw me a curveball. And I think it was maybe like 6 months ago, he all of a sudden just kind of like, almost like changed his mind about something, like what he was going to watch versus what he was going to treat.
Uh-huh.
And I pulled him aside after, and I was like, okay, we got to go back through this. Like, we kind of lost our jive there for a second. And sometimes, like, just taking that second, like, people change, they evolve, they're, the way that they see things and think about things is different, and so we were able to kind of touch base on that again. But what's really cool is that, go ahead.
No, go ahead. Keep going.
What's really cool now is that, we're open for 2 years. We are just about ready to hire another hygienist. Hallelujah. I'm so excited about this. I can only clean so many teeth in a day. But I went through and I created the co-diagnosing how-to, and literally, like, every single thing that we treatment plan, I have x-rays and pictures, like, going through everything. So now when we hire a hygienist, he's done. He did all of that legwork. Now it's going to be my turn to, teach this to someone else and make sure that we're on the same page.
Man, I want you to work in any practice I ever owned, because that's just amazing that you've taken the foresight, you've looked at that, you've got the x-rays. Like, how cool is that to explain that? And that's an amazing calibration for your other hygienists that come in. Like, that's called, you've got a system right there. That is the epitome of systemization. And so what also I was going to say is, when you said you went and talked to Dr. Dan about some of his treatment where he changed, it's okay. Like you said, we all grow, we all evolve, we all morph. But when you felt comfortable to go ask him, like, hey, I want to help you out, I want to know why you're changing this, let's recalibrate, because he'd already opened that communication with you from the get-go, you were then able to feel confident going and asking him for help. So I just love so many pieces to this, like open communication from the get-go. He spent about a month. Honestly, docs, I would say this happens all the time. And I hear doctors getting very frustrated, like, why can't my hygienist just tee up treatment or like preheat the oven so when I walk in, my exams are faster? And I think this is actually a really, really, really great tactical way that you can get your hygienist up to par. So I love that you gave the time frame. So a month's time, go through. The first day it was like patient by patient by patient. And then after that, maybe at the end of the day or over lunch, just pulling up a few treatment plans that you did, reviewing them with your hygienist. Kristen, he was always the teacher, or would it get to a point where he would turn it and say, okay, what do you think? I have a treatment plan in here. Did he ever do some like that where you would get to tell him why? Okay.
Yes, exactly. Yeah. So, he would pull up a picture and, it would be a tooth with a large amalgam with, 2 fractures. I mean, it's pretty obvious. He's like, how would you treatment plan this? And I would say, build up in a crown. But it's funny because, like, thinking back, I'm like, I had so many dentists that I worked with that are like, oh, it's just a couple crazy lines. Like, we'll watch it.
Right.
But so he went, he turned the tables on me too, and, had me create the treatment plan, and then, he would say why he agreed with something or why he didn't. And it's really important to remember always, so many things in dentistry are subjective.
Yes.
Right. So it's not about getting something right or wrong. It's not a yes or a no answer. It's just learning the way that, you're going to do things collectively. So, if you're, even if it's a patient that you're seeing today, and you recommend, a crown or an onlay, and your boss comes in and says, oh, you know what? I think that this tooth is also going to need a root canal, and you didn't see that. Maybe the existing restoration that's there is like sitting right on the nerve. It's okay. Like, it's not, he's not, or she, they're not going to think that you're wrong or you're stupid or anything like that. It's just important to, get it as close as possible.
Absolutely.
So it's not a right or wrong.
I think it's an alignment. And I love that you pointed that out, because I think so often we are scared of being right or wrong. And if we say it wrong, it's not a good thing. And I remember I read a really cool article. Gosh, it's been a few years. I can't even tell you who wrote it. I should definitely know my stats better. But it was an article that talked about how you need to be able to fail and fail successfully. So meaning it's a safe space for you. And I don't even think this is failing when you don't say it the way your doctor would say it, but it's a safe space. It's a learning environment, so you can just get better. And like you said, it's not a yes or a no or a right or a wrong. It's just aligning with your doctor. And I want you guys to know, Kristen is not diagnosing treatment. She is not diagnosing. She's not telling the patient what they need. Dr. Dan is still coming in there. So I want that to be crystal clear. The hygienists are not diagnosing treatment. Doctors are doing it. But basically, Kristen's becoming the first of a series of 3 to tell the patient what they need. And so it's kind of the rule of thirds, or, by 2 witnesses, you're going to believe it's true. But when there's more people that confirm the same thing, it's much easier to believe it's true, because it's coming from Kristen, it's coming from Dr. Dan, and then it's coming from the treatment coordinator, all because Kristen aligned with Dr. Dan to know what Dr. Dan would treatment plan. I bet you, Kristen, I'm going to put out a bet right now. I would guess that Dr. Dan's exams are much more succinct with you doing this with your doctor than they are otherwise.
Oh, for sure.
I guarantee you. And that's what hygienists complain about all the time. Like, our exams take forever. They take up so much time. I bet they're so fast and speedy now that you guys are aligned.
Yeah. The longest part of the exam is Dr. Dan talking to the patient personally and getting to know them as a person, and so our exam start to finish on a new patient, unless it's a really extensive treatment plan and it's like very complicated, it's probably 6 minutes long, I would say, 6 to 10, depending on what's going on.
That's a new patient. That's not an existing one. That's a new patient. That is a quick exam for a new patient. That's awesome.
Yeah. And so this is kind of a nice segue into the next thing I wanted to talk about is how to then prioritize treatment so the exam gets even faster. Because if a patient if they need restorations on all of their posterior teeth and, implants and extractions of bone grafts and ortho and an occlusal guard and perio, you can't go through every single thing in such fine detail. The patient is going to completely blank out, and they're going to run out of the door because they're confused and nothing's going on. And you just spent 25 minutes talking to them about treatment they're not going to do.
Mm-hmm. Exactly. Okay. So go on. I'm excited to hear.
So the next thing is not just calibrating with your doctor, it's also calibrating with your patient and finding out what their value system is and what their personal priorities are. A lot of patients will just say well, whatever you say, I'll go with whatever you say. And then you say, okay, well, first thing you need to do is this implant, and it's, X amount of dollars. They might run out of the door if you don't find out what's really important to them. Some patients are still very hung up on insurance, and budget is a big deal to them. And that's fine. My job is not to judge somebody based on what their budget is. That's the opposite of what my job is. My job is to do everything we can to get them the care that they need that's going to give them the biggest impact. So literally one of our forms that the patient fills out at the beginning of their appointment, along with their health history, is a questionnaire about what their value system is. Is longevity important to them, or is cosmetics more important? Somebody might want to go into whitening or veneers, unfortunately, before they want to fix cavities and things like perio. Obviously, you have to kind of train the patient. I'm not going to let gum disease go before we do whitening or veneers, but it's just good to kind of figure out what it actually is that they're looking for. Because if they really want that cosmetic work, they're going to do the necessary things first,
I completely agree. 100%. And knowing what they actually want and what their driving factor is, it makes it so it's personalized and more efficient, and it just feels better all the way around.
Right. So typically I like to keep it to maybe 2 or 3 major things. I let the patient know after I've gone through their x-rays and their pictures, listen, a couple things going on. I'll show them one x-ray and I'll say, this is what a cavity looks like. Sometimes I'll bring up Guru and also show them, the video on how cavity progresses. Mm-hmm. I'll say, this is a cavity that the doctor's going to recommend for a filling because you can see this dark area has gone into the next layer of the tooth. Here's a cavity that's in the very outer layer. He probably won't recommend a filling there. And I'll then segue into fluoride.
Yeah, exactly. Right there. Nice.
Exactly. And then, so they have an idea of, what kind of tooth would need a filling, et cetera. And then I'll say, there's multiple teeth that look like this. So then they have an idea, okay, I'm going to need a few fillings. Mm-hmm. I'll bring up another x-ray, say there's a much bigger cavity, and I'll say, okay, so you have one tooth that looks like this. You can see the difference between this and these small areas, right? Mm-hmm. Yes, great. I'll explain, what Dr. Dan probably would recommend. And that's the thing. No, I'm not diagnosing. I'm letting them know what he's going to recommend so their wheels can start turning.
Totally. You're planting seeds. That's what you're doing right there.
Exactly. And then I might say, go into perio and say, about their pocketing and the systemic link and all of this and explain how important that is. I'm probably not going to go over every single tooth one by one, but I'll say, okay, you have cavities and precavities and you have gum disease. Those are the things that are really showing up widespread across your mouth. Let's tackle, these 3 things first. We'll go into the smaller stuff later because that probably we have a little bit more time on that. What is most concerning to you? Mm-hmm. They might say that huge cavity on my upper left, that looks really scary. Let's take care of that. Or they might say, my gums really concern me. And we'll say, great, if we can do both of them in, relatively around the same time, we'll see if the numbers align for you and we'll get both of those done. If budget then really ends up being a bigger concern, then, we'll pick the one that's going to cause a bigger pressing issue for them. Mm-hmm. And then there's patients that don't care about budget and they want to do everything. And then we just decide, what is of highest severity. But I think having things already outlined in priority, and it sounds so like, yeah, duh, of course, like that's how we should do it. But there were times in the beginning that Dr. Dan would ask me before he went into the appointment, okay, well, what's important to the patient? What's priority number 1? And I'm like, well, everything is priority number 1. Everything is important.
Yeah, exactly. But when everything's important, nothing's important. So smart questioning. Yeah. Okay.
Yeah. Yeah. So, and then, finding out from the patient, like, exactly what the first thing that we're going to work on. Sometimes I'll even say, listen, if you have to pick one thing, what is it that you want to start with? Because it's ultimately up to them. If they say, well, I want to get my teeth whitened, I'll say, great, let's do that after we do your root canal. Mm-hmm, mm-hmm. Yep. But, so Dr. Dan will then come in and then I've already debriefed him in the hallway, mm-hmm. Just to kind of let him know what the value system is. Mm-hmm. And then I'll basically repeat it in the room, but directed either to the patient, and then just go through priority there. So again, the patient, we've talked about it. We're hearing it again. We know what we're focusing on. And a lot of the time, if I'm like really certain about something, I've already sent a message to the treatment coordinator to start getting the financial arrangements ready. So when the patient comes up, they're good. And she knows what we're focusing on first.
All right. So there's like a lot of pieces to this that I'm excited and just like giddy about right now. One, you're just proactive on every accord. Everything I'm hearing from you, like, hey, if I'm pretty certain it's going to be this, send the message on up to the TC so they can get ready to go. Like, hallelujah, I could hug you as a TC. Like, thank you for like giving me a heads up. So love that. Also, I love that you've prepped these patients exponentially and you found out what they want. So that way it's like, all right, which one of these is the most concerning? Let's figure out where your baseline is. You already, like, this ties back to the whole assuming things. You're assuming that they want to get this done. You're not even asking, like, it's like, okay, what's the most concerning to you? Like, we're going to do something. What's the most concerning to you? So I love that. And then the other piece I was thinking is I can, like, this is a piece that I'm obsessed with, but I want to dive into it because I know I can already hear some other hygienists that are not you. I think it's impressive that in your time frame as a hygienist of when you're seeing these patients, you're taking x-rays, you're taking your full mouth probes, you're talking to the patients about the treatment that's in there, you're getting your cleaning done, you're doing an exam, you're getting your fluoride done because you do a crushing job on fluoride as well, and you're getting your patients out on time. Because I was in your practice and I watched you stay on time all day long. So I think it's wildly impressive because I'm not a hygienist, but to say like, hey, here is a hygienist who's just like you that can do these things. Talk me through how you are time efficient, because I can hear a lot of them saying like, that's great, that's Kristen, but there's no way because I can barely get my exam and cleaning done before, and I'm running 10 minutes behind always. So how do you manage time with this to talk about every single one, like x-ray with your patients, show them what's going on? How do you timely do this? And so time management, because you do not have a time management issue at all. So what are some tips and tricks that you have regarding that so other hygienists could do this like you do?
So time for me personally is so valuable. And I think, I don't know if it's just, where the practice is, where everyone has a very busy lifestyle. So I know that time is really important. I've worked in other offices where we have just run so behind all day. Nobody's happy. And that's like my number one thing is stay on time. Obviously things happen, but I time block it in my head. So my new patient appointment is 90 minutes long. That does not mean that I am personally with that patient for 90 minutes. Most of the time I am, but so I'll block it like the first 30 minutes. Hopefully the patient has already filled out their forms. Hopefully they are there on time. I know all the hygienists in the world are like screaming at the top of their lungs when their patients are 5 minutes late and they have not filled out their forms.
Yep.
And then it takes them 20 minutes to fill out their forms. Drives me insane. But so that's number one. Assuming that your patient is there on time, you can bring them in on time. I already have everything is set up before the patient comes. I'm talking x-ray sleeve is on the sensor. Everything is there, is ready. Everything is on my tray. I have the sheath is on the camera. Dexis is open on the patient, ready to go. A huge pet peeve is like you bring a patient into the room and then things are not set up, things are not there, things are not ready. So it's super important to me to have everything ready to go. FMX will take me probably 6 minutes, depending on how easy the patient is. We have gaggers and we have narrow palates and all of that.
So hygienist right there, if you don't know how long an FMX takes you, because you should know, you are like the guru of taking x-rays, get it down to at least 6 minutes. It is so easy to do that when you actually time yourself, but you've got to know how fast you can do it. And if here's another hygienist just like you crushing the FMX, 6 minutes flat, guys, for an FMX. Time yourself and get up to that because that's the standard. I used to do the same thing as an assistant. I timed myself to see how quickly I could get FMXs done. And then I taught at a dental college to teach everybody how to do FMXs. You can literally get those FMXs down pat. So I love that, Kristen. 6 minutes, guys. That's an impressive record. Nice job.
Thanks. Trying to not stop and chat to the patient too much, or this can be the period of time where like you're doing more of the talking, because it's weird and it's awkward when the patient, you can't just neither of you talk, for
you're in pretty close proximity when you're putting those x-rays in. Let's be silent and look at each other in the eyes. It's real weird.
So if I were to ask the patient a question, I'm going to ask it to them after I press the button. I'm coming back, into the room. I'm taking the XCP out. I ask them the question so they have a minute to kind of rest for a second, answer the question. I'm changing the XCP to the next side because there's 3 seconds there. They can answer like, an easy question there. You're getting to know the patient. Bring them so we have an imaging room. We don't have tube heads in every room. So I'm bringing them from the imaging room to the treatment room.
Right there, you guys. She doesn't even have the x-ray unit in her room. So that's an extra step that she's got to do that a lot of other hygienists don't have that extra time that they're losing. That is a loss of time to have to switch rooms. because you got to move them. It's the changing of rooms. So that already there is awesome that you can even do this with that added, what do they call it in golf? Is it like a handicap when you don't golf as high? Like that's a handicap for you in your practice. So go on. I'm loving this.
Yeah. So, I mean, that's another, opportunity to, chit chat a little bit, get to know the patient. That way it's not taking out of the time that you should be working in their mouth. So, they're seated. I let them know I'm going to take some intraoral pictures, bring them back. So we have, TV screens on the ceiling. Now I always ask the patient, would you like to watch something on TV? Because I'm going to be doing a lot of the preliminary, examination. Would you like to watch TV, or would you just like to kind of like hang out while I do my thing? I love when they say they want to watch TV because I'm able to just run through it and they're not sitting there awkwardly while I'm working. You know what I mean? It's kind of like a win-win. Surprisingly, I get a lot of people that say, no, I'm good. So maybe, I don't know, maybe I should find some better verbiage. Be like, I'm going to set up TV for you. That's what I should start saying. Totally. Actually, I'm starting to think about this a little more. Not would you like to? Because most people will say no.
Correct.
If it's like they have the option. So,
well, I think about anytime for you guys, this is a good visual that I painted of, think of when you go to a restaurant and they bring out the dessert menu. So there's two types of restaurants. There's the restaurant where they're rushed and they're wanting you to say no. And so they're like, do you want to see the dessert menu, as they have the receipt in hand ready to go? And you're like, no. Right. Like anytime they say like, do you want to see the dessert menu? It's very rare that we actually say, yes, I've watched this. I study it like in my own study form. It's not actually researched out there that I've seen. But then there's the other ones that just assume and they'll bring you the dessert menu. And like, here's our dessert menu for tonight. So I think for you, Kristen, exactly what you're saying right now, you just switched that for yourself. If you say, do you want to watch TV? Most people feel weird because they're going to just say no. They're programmed to say no when they walk into the dental office. So like, let me just get this TV set up for you. Here's the remote, and just give it to them. Because you're right. That makes your life so much faster if they're not chatting with you or awkwardly waiting on you.
Right. Yeah, great. I'm learning for myself. This is perfect.
I love it. That was good. That was solid.
So then, intraoral pictures, I would say like 4 minutes.
Are you taking pictures of every single tooth, or are you just doing the areas of concern?
Every tooth. So we'll do, every molar shot separately, premolars together in one shot, canine to canine in its own shot, kind of like palatal or lower. So it's not always 32 shots.
Sure.
But yeah, actually probably like 3 minutes. I should time myself on that, but I know it's quick. Last thing you want is the patient to be able to see the pictures as you're taking them, because we do have that option to mirror the pictures there. You don't want that. The patient will ask you about every single tiny thing that they see on the tooth, and they're going to start freaking out. Before you even tell them what's going on, they're overly concerned, and then you have to kind of talk them down. So best thing, don't let them see it until you already have the ideal treatment plan already kind of figured out and charted. So then I'll have an assistant come help me probe. So I'll already figure, typically by the x-rays, you kind of have an idea if they're going to need SRP or not. Although you do sometimes get those surprise pockets that there's no calculus showing up on the x-rays. So always probe. Don't skirt around the probing. Always probe. I actually, side note, I had someone I know who's a hygienist, and this haunts me, told me that on one patient, she did not probe, and the patient's like cousin or someone was a hygienist, and they're like, oh, like you didn't take those numbers. Like my cousin told me that I should always get those numbers taken, and she was like mortified. So I'm like, I would never let that happen to me.
No, that's terrifying. Okay.
Yeah.
Dental IQ out there is getting stronger.
Yeah, exactly. It's important. People need to know what's going on in their mouths, right?
Yes. And you as a hygienist need to know that too. I know it's a pain, but I'm guessing, I've never probed, but I'm guessing it gets faster the more you do it, to where you can get this down pat and it doesn't take you as long as it did when you first walked out of school.
For sure. I would say full mouth probe is probably another like 4 minutes or 5 minutes, because you want to be accurate, obviously,
Sure.
but, you don't want to painstakingly say, oh, is this a 3 or is this a 4? Or is this a 5 or is this a 6? Like, you just go for it. And that's the same thing when it comes to looking at x-rays. And this is how you get really fast with it. For the most part, go with your first gut feeling. It's typically like it needs a filling or it doesn't. If you really have to think about it, then just mark it on the side and say question mark. I do that still sometimes. I'm like, I don't know what he's going to say here. I'll even tell that to the patient sometimes. Like, it really could go either way. So we're going to leave it up to him because ultimately, he's the dentist. This is, what he does.
Yep.
But yeah, so I would say first 20 minutes of the appointment is just data collection.
Okay.
So basically everything that I need to know about their mouth and what, and write down the treatment plan. 10 minutes for me to talk the patient through it. Obviously, if it is a very complex treatment plan, it might take a little longer. And that's when it's, again, really important to just pare it down to like 3 things. If you know that it's going to be super complicated, and you can tell the patient, listen, like, okay, so this is what I see going on. These are the 3 most pressing things that I'm seeing. If you want to know about every single tooth, we can definitely let you know, but I want you to kind of focus here. If you need more explanation and detail, even after we're done with Dr. Dan, it might be best to come back for a consult appointment, or let's talk about it at your first filling appointment. Like, we're not going to leave you unaware, but not everything needs to be answered, at the first visit.
Right. No, I love that. And then you go into cleaning, I'm guessing.
Yeah. And then you go cleaning mode. We have tried, and when it works out, it's great for Dr. Dan to do the exam before I do the cleaning. That way the treatment plan is already fully set. FAs are complete. And then all I have to do is just prophy, fluoride, sealants, if that's something that the patient agreed to for that day, which I always try. If I'm treatment planning sealants, I always try to do it same day when possible, just to kind of get it out of the way. And also it adds a lot more value to the patient for their first visit.
Sure.
But yeah, so typically it's prophy and then exam. Prophy 20 to 30 minutes. And then exam, I usually give about 10, block out in my head. So I try to, even though I have a 90-minute appointment, I try my part to be done in 60 minutes. That's what I try to go for.
I like it's such a good visual when you say you block it in your head of like, this is how much time, this is where I need to be. Hygienists, if you can't block that in your head, writing it on a sticky note so you can see what part of the procedure should be is awesome, because I really do think that when you're time conscious, we can get so much more done. I know when I don't have something pressing up behind me, I can chit chat. I'm super great. But when I've got something there, I'm so much more proactive with my time, and I can get a lot of things done. It just depends on how I prioritize that time. So I think it's a matter of what's a priority to you. But I love the nuggets you shared of how you do it, how much time you spend on each thing. This is real life. This is not scripted. Like, this is what you do every single day. And so getting that dialed in. I also loved something that I had never thought of that I thought you pointed out really well, is you actually put in your tentative treatment plan. So it's already in there phased before Dr. Dan even comes in. You can change it, but that's so much faster than you guys sitting there entering everything. But that came from, like, circle all the way back to the beginning of the podcast. That came because Dr. Dan spent a month training you, getting you up to par, getting you calibrated, so you literally could be super efficient with this. And I will say, of all the practices I've seen, Dr. Dan works in one of the most efficient ways I've ever seen. His mind just thinks in efficiency mode constantly.
Oh yeah, he's like insane. When I first met him, I'm like, are you a real person?
Right?
Like, this is like, who are you?
Fun fact, he's from South Africa. Did not know that. I was shocked when he told me that. But regardless, I love that that he has trained you so well. And so I think all those little pieces of training make it so you can be so much more efficient. I mean, if that treatment plan's already in there, I'm guessing Dr. Dan, so from a doctor's angle, I'd be curious to hear his side, but I'm guessing from a doctor's angle, he's able to look at your treatment plan of what you already put together, like, yep. Oh, I'm going to change this. And it's even faster for him and makes his life easier because you're spending all that time reviewing everything. I know a lot of doctors just walk in, they want to pop in, pop out. And this makes it truly a calibrated, a directed, a controlled process that Dan taught you before to get you up to this place. So like so many nuggets in here, Kristen. That was a power-packed episode you just put together.
Yeah, we went all out.
We did. So all of you hygienists, I would say circle back. Like you can tee up the treatment, just like Kristen said. Learn from your doctors. Doctors, train your hygienists. I mean, he did this, almost 2 years ago, and now Kristen can train all the new hygienists coming in. She's teed it up. She just broke down a new patient exam of how she does it, how much time she spends on each thing, literally how she works through this with every single patient. Different pieces you can do, how to educate your patient, how to get the treatment plan in there, how to alert the front office, and be done on time. I watched her for 2 days. She was on time for every single patient. So it's not she's just sitting here saying these things. I physically watched her in the practice on time all day long. So Kristen, gosh, any last nuggets? Because that was solid. And I think you knocked this one out of the park again. It does not surprise me. You're just brilliant in so many areas.
Wow. You're like so good for my self-esteem. Like I feel like I'm going to call you every day. Like, Kara, can you just tell me how good I am?
Yeah, absolutely. And I mean it with every part of me because there's so many hygienists who tell me, I can't do this. I can't be on time. There's no way I can add anything into my 60 minutes. And so to hear somebody who said like, forget that, I can do this and this is how I can do it just makes my heart so happy because that's what I want to hear. I believe if somebody else can do it, you yourself can do it as well because somebody's proven that it can be done. There's no more excuses, at least in my book.
Yeah, it is totally possible. I think so, going back to last episode when I was talking about, tracking yourself, and, tracking your fluoride and seeing how many patients you're doing it on every day. It's the same thing. Track your time.
Yes.
Track your time. I love Open Dental because it has the red line constantly going across the screen. I can see in a glance where I'm at.
Brilliant.
And don't be afraid of getting it wrong, and don't be afraid of pulling your doctor aside and say, listen, like, I want to be as helpful to you as possible. I want to really feel like I'm part of this process with the patient, and I want to make your life easier. So if you could just take 5 minutes a day for like the next week, and let's just go over some of like the new patient treatment plans, it's going to make it easier for both of us. Don't be afraid of your bosses. I mean, if you are, then maybe it's not the right office for you, but don't feel like you can't approach them and ask them for help, because by you asking for help, you're helping them.
Absolutely. I love that. And I love that you just gave it a safe space of don't be afraid to get it wrong. Until you try, you don't know how you'll do. And until you keep trying, you don't know how much better you'll be. So man, Kristen, we're going to do another one because I just think you've got so many awesome tips that help hygienists realize their potential of what they can be. And I love that you do it every single day. So it's boots on the ground, real life. That's what I love about you. So thank you. Thank you for joining me. Thanks for being on the podcast. And thanks for just loving our profession so much and being truly incredible at what you do.
Oh, thank you, Kira. This is so much fun.
You are so welcome. All right, guys. So this is a power-packed episode with Kristen. Thank you, as always, and Dental A Team listeners. I will catch you next time on the Dental A Team podcast.
And that wraps it up for another episode of the Dental A Team podcast. Thank you so much for listening, and we'll talk to you next time.